Buddy, how are you guys doing today? My name is Eric Christensen, obviously owner of Chandler Physical Therapy here, and today we're talking all about vertigo and dizziness. And number one, did you even know that physical therapy could treat vertigo and dizziness? Because we do, and we do it a lot. It's one of those things that I have patients come in all the time and be like, oh, I didn't know you do it. And actually my therapist, Hannah, just said, hey, would you mind making a video about this? Because people didn't know that I did it, and there's a lot of people suffering out there. So here we are talking about vertigo, talking about dizziness in general. And there's a fine line between like generic dizziness, which can be caused by a lot of different things, and vertigo, and which also, again, can be caused by actually a lot of different things. But vertigo in and of itself is defined by the feeling that there's a spinning around you, like the world is spinning around you. If you just feel disconnected or almost lightheaded, or like I just don't quite feel grounded, that is what I would classify more as dizziness. And that's going to be treated slightly different than vertigo. And the most common cause of vertigo that we see walking through our doors, and I'll see if I can pull it up here so we can actually look at it, is what we call benign paroxysmal positional vertigo, or BPPV for shortness, which helps in documentation. And basically what happens is we have these little canals. We have a center part of the canal, and then we've got these, or center part of the inner ear, and we've got these little canals that come off of it. And we have three different ones in different positions and different planes. And in those canals, we have little hair cells. And in those hair cells, they're weighted at the end by a crystal, so that when we turn our head, the fluid in our inner ear pushes those hair cells to one way or the other. And what that does is if I turn my head to the right, my hair cells get pushed a certain way, and it allows my eyes to stay focused on the camera. And if I turn my head to the left, the same thing, my eyes track this way, because the hair cells are telling my brain I'm moving to the left at a certain rate, and my eyes need to go to the right at a certain rate in order to maintain my gaze. What happens sometimes is those little crystals can break off from the hair cells and start. So that when I turn my head or I lay on one side, you get this little crystal rolling around in your ear that then stimulates those hair cells. So it makes your eyes move, because it's saying, oh, you're moving so far this way, my eyes are going to go this way, and it makes the world spin around you. And that's the type that if you look up on the internet, they tip you backwards and your eyes kind of go like that. It's very nauseating in terms of getting treatment, but actually that's very easy to treat. And what we do is like one of those old school like little games where you have like the marble and you try and get it in the hole. That's essentially what we're doing with that crystal in your inner ear. We're going to take you through different positions to kind of tip you around to allow gravity to pull that crystal to one part, move, it's going to pull to the other part. And while it's rolling, it will give you symptoms. But once we get it centralized, rarely does it come back out, and often you're symptom free after that. I would say most people are seeing a maximum of 3 times, and then their symptoms are gone for the vast, vast majority of it. What sometimes can happen after that, or when folks come in and they don't have that BPPV, is they might have this cervicogenic dizziness, which is just a fancy word for dizziness coming from the neck. And that can happen if you're like really trying to stabilize your neck because you've got the BPPV, or it can happen independently of that. And that basically is more of that disconnected, I'm floating, I don't feel grounded type of sensation. And what we see is that the muscles in your neck, they need to move your neck around, but they're also very dense in what we call muscle spindles. And muscle spindles are little detectors, little receptors, I should say, in your muscle that basically tell you how fast you're moving and how far. And it gives information to the brain about that muscle contracting, so that the brain can get a sense of where the body is at in space. It's something we call proprioception. We have the inner ear, the vestibular system, we have proprioception, and we have our vision. They all have to combine in order to give our sense of balance and awareness of where we're at in space. If one of those is off, then we start to feel like we're disconnected. And that's very often that dizziness, or I turn and I just don't quite know where I'm at. Maybe some people say it feels like I'm drunk a little bit. All that sort of stuff can be related to this kind of cervicogenic dizziness, or what we might call sensory conflict, because you're getting 2 pieces of information that don't line up. And very, very commonly what I see is someone who is visually dominant, their eyes are dominant. So if we take away their gaze, they maybe get a little dizzy. Or if they're not tracking well with their eyes on items moving left and right smoothly, then they start to overuse other muscles and they might start to tense up. And if we have this muscle telling us that we're moving to one side at a certain rate, and this muscle isn't giving that same feedback, and then our eyes are mismatched, that's where we start to get that dizziness. And we start to say, okay, I'm supposed to turn this way. My inner ear is telling me I'm moving a certain way. My eyes are saying this, and then my muscles are saying this. Something's not right, and I'm getting dizzy. It's very similar to if you're sitting in your car, you're stopped, but the car beside you pulls forward, and you slam on the brakes because it feels like you're going backwards. Your body's saying, I'm not moving. Your inner ear is saying, I'm not moving. Your eyes are like, you're definitely going backwards. Hit the brakes. And so that is that conflict that we have to resolve. And we do that in PT through not only getting the neck and mid-back all moving well, but then also training strength and what we call calibration exercises, where we have eyes tracking different objects, heads moving at that time to start to retrain the body and how to interpret those signals. So if you do have vertigo or you have dizziness and you want to get in, we do have that free discovery offer. Obviously, it's available anytime. You give us a call. You can message us, say, hey, I want to get in. Or if you just have general questions that aren't related to vertigo, let us know. But I hope you guys have a great day, and we will see you on the next go-round.